Hey, it's Hillary. Join me for a helpful and hopeful chat about mental health in our community. So grab a cup of coffee or tea. This is Wedgwood's Coffee Break Conversation. Today is going to be a good one. I am joined by Gina Boscarino, a member of Wedgwood's Positive Youth Development Team. Thanks for being here, Gina.
Thank you for having me.
I'll let you introduce yourself and talk a little bit about what you do here at Wedgwood.
All right. Well, my name is Gina Boscarino, and I have been here. I was hired in 2011, so I officially started in 2012. And I'm a member of the Positive Youth Development Team, and I work as a group specialist. And there's kind of two parts to my job. One of them, I work in schools, and I'm a prevention specialist. And in the other part of my job, I get to work with a great group of teens called Teen Charge.
Oh, fun. What is Teen Charge?
So Teen Charge is a group of teen leaders from all around the city. And these are kids that apply to be part of this program. We meet twice a month typically and talk about the areas that they think they could improve. We talk about what problems are for teens, and we talk about ways that we could improve them. We also do a lot with social media, creating videos and other content to educate other kids their age about issues like mental health and healthy relationships.
Oh, that's cool. I love that they speak into what they want to talk about. That's really cool. So, like you said, you and your team spend a lot of time with teenagers in various schools across the community. Mm-hmm. How would you describe middle schoolers and high schoolers today?
I would describe middle schoolers and high schoolers today as really searching and looking for identity and a way to belong. And I think that's not new, but I think especially with this generation, kids are feeling like there's so many more choices and they're seeing so many different things in social media and on the news. And I don't think a lot of kids feel like they have someone to guide them.
Oh, interesting. Yeah, with social media and kind of the infinite access to the internet, the whole world is open to them.
Absolutely.
And sometimes they're on the internet without a whole lot of real guidance.
Yeah, definitely.
How do you think that things have changed? So you said you started in 2012. Mm-hmm. Since 2012, how has kind of the landscape for teenagers shifted?
Well, when I started in 2012, vaping was a thing, but it wasn't quite as big as it is now. We also have seen like the rise of TikTok, and Snapchat was kind of just coming out around then. And now kids absolutely live and die by Snapchat and TikTok. Yeah. Social media in itself, I feel like, is just becoming more invasive.
Oh, interesting.
When it was just Facebook, it was just kind of posting pictures and, posting on your friends' walls, sharing statuses. Now it's a lot that's done in real time, and kids are recording things live, and that isn't always the best when you combine that with kids who don't have fully developed brains. Mm-hmm. They don't think about the choices they're making. So we see, a lot of that.
Yeah. I was talking to somebody the other day, and they have a teenager, and they were talking about how their kid doesn't have any of their friends' phone numbers saved in their phone because they just communicate through Snapchat.
Yeah, they just
which
Snapchat
is,
them.
For me as a millennial, is like a mind-boggling thing to think about.
Yeah.
But that's how they communicate now.
Yeah, absolutely.
And that probably wasn't the case,
Nope.
10 years ago.
It's really taken the place of texting.
Interesting. Mm-hmm. Interesting. So kids are on the internet and on social media pretty much constantly, but do you feel like they have the understanding and like the literacy to use it well?
Some kids do, definitely. I don't want to, because some kids use it appropriately and they know when they're using it too much, or, some kids will say to me, social media is dumb. Like, I'd rather be outside. And I love it when a kid says that.
Yeah.
But I think the majority of kids don't, unfortunately, because we start handing kids cell phones around like 9 or 10 years old, and it's good so that we can contact parents and everything like that, but at the same time you're handing your child something that gives them access to the entire world, and even with parental controls, kids can still get into lots of different things, and they're not at that point in their own development where they can make some of those choices about what's good and what's not.
Yeah It's kind of scary to think about. But it gives me a little hope to hear that some kids are also starting to see like, that's maybe not the best thing for me. I'm going to go outside.
I've heard kids say like, well, I know when I spend a lot of time on Instagram, it's not good for my mental health. And I appreciate that these kids can recognize that.
Yeah, that's awesome. So over your years working with teenagers, what are some of the things that you've learned from kids?
I think the biggest thing I've learned is that students just want to be heard. I mean, that's not new. I think that was still happening, when we were young, but kids are just so desperate to be heard. And maybe it's because they have outlets like social media where they're putting all of their thoughts out there, but because there's so much going on, I mean, they're just another voice. So a lot of times I'll have students come down to my office and they'll just talk and talk and talk. And I'll say, well, do you want, can I help you with that? Or I'm trying to think of solutions because I'm an adult. And they'll say, no, I just really needed somebody to vent to. And I think one of the most important things I've learned during my time at Wedgwood, I learned from a student. She told me that when she goes to her mom and she's upset about something, her mom always asks her 3 questions. And she says, are you looking for advice? Do you need someone to help? Or do you just need to vent? And she said that always made her feel so empowered because she could go to her mom and she didn't have to worry about her mom taking charge and, calling other moms or whatever it was. And sometimes, kids don't know what it is they want.
Yeah.
And sometimes it is. They just need to vent. They just need to talk.
I love that.
That's one of my favorite things. And I've tried to keep that in mind when I work with students.
Yeah. And it all comes down to communication, really.
Yeah.
But to have that open communication between whoever, kid and an adult. Because how frustrating was it as a kid, if you just wanted to complain about something, but, your mom just is like, okay, you need to do this. And that's so frustrating. And to take that out of the conversation and just...
Yes.
Oh, I love that. That's so cool.
We did some surveys this year through Teen Charge asking kids about some of their biggest concerns, and I ran some focus groups. And one thing that kept coming up again and again is that kids say, oh, my parents say I can tell them anything, but then when I tell them things, they get mad. So being able to provide a safe space is so, so important. And yeah, they might tell us things that are going to make us mad, but we kind of have to take ourselves out of that equation and just be there to support them.
Yeah. And that can be tough when you really care about a kid and, I love that. So you touched on this a little bit, but are there other things that are big concerns for students, and are there things that teachers are concerned about as we kind of head towards the school year?
Well, for students, substance use is a huge issue.
Okay.
Students vaping at school, you can ask pretty much any kid at any school and they'll tell you how prevalent that is. And now we worry less and less about them vaping, flavored tobacco or flavored nicotine, and more about kids vaping marijuana. And the amounts that kids are taking in when they are vaping is so much more than they would be taking in if they were, smoking a joint or something like that. So that's probably one of the biggest concerns. I think for teachers, a big concern is, again, phones in the classroom. That's a huge battle constantly. Anything having to do with technology. I think mental health as well. And not all teachers are trained in mental health. Here at Wedgwood, we have such a focus on being trauma informed.
Sure.
And not all schools value that, that they have so many other things that teachers need to know. But I always just kind of assumed that was something that was taught, when you go to college to be a teacher, or that it was just so important for that. So it's really nice for us to be able to be in the schools so that we can talk about that.
Yeah. And I love the way Wedgwood has it set up where you're in schools, because it feels like it takes that burden off of teachers to have to also be the mental health support.
Absolutely.
Or the, substance use prevention person. While they're also trying to teach math and, all those things. So I love that it's like a partnership.
Yes.
You're coming in to support, the students, obviously, but you're inadvertently also supporting the teachers, which is super cool.
Absolutely, yeah.
You mentioned vaping, and I know I heard a lot about this at State of the Child from teachers and even from the kids that we interviewed as a part of the panel, that vaping is still a big deal.
Absolutely.
A lot of the kids reference, I know not to go to this bathroom, and which is wild to me. So how are you and your team addressing it when you're working with kids and in the schools?
Well, the biggest thing that we're doing is prevention. A lot of that includes education. We go into the classrooms. We do a little bit of one-on-one. We also do a lot of teaching of skills. Kids need to be able to know how to say no and how to also find healthier ways to cope with things. So that education piece is really big. Resilience, I think I mentioned that before. Resilience, that ability to bounce back when negative things in life happen. If kids don't know things like emotional regulation or how to handle disappointments in life, they are more likely to turn to things like vaping and alcohol.
Yeah. You mentioned the education piece, and I think it's important, obviously for kids to know, to understand what vaping is and like what is all involved and how can it impact you, but for adults too, it's super important to know. I've heard some of our substance use specialists talk about how it's not your grandfather's THC. It's much stronger now than it was, so it has a different effect on kids. And at State of the Child one year, one of the panelists talked about the amount of THC that can go in a dab, which goes in a vape, I think, so I'm using all those terms correctly, is so much more concentrated than, like you said, like a joint. And so
you could get like 80 to 90% THC.
Which is crazy. And it's odorless. So you wouldn't know.
Yeah.
So how do parents kind of stay on top of that when there's all of this happening and kids are smart?
That's the big question. Yeah. Well, I think for parents, it is really important as well to be educated and to know about the risks that are out there. A lot of times, like you said, kids are smart and parents don't exactly know what to look for. We have a program called Hidden in Plain Sight, and we are going to be bringing that into schools, into churches, into anyone that wants us to bring it by. And it's actually a model of a teenager's bedroom. And
cool.
You can go through it, and you see all of the different places where different paraphernalia could be hidden.
Ooh.
And it's pretty surprising. It's pretty shocking, and I think there's a lot of things that parents wouldn't even think of. So just knowing, what certain things are used for, that kind of a thing.
And I think it's probably also safe to not assume that just because your kid is a good kid and you guys don't talk about it at home doesn't mean they aren't going to hear about it at school.
Absolutely. Yes, absolutely. And even though they're a good kid, it doesn't mean that they're not doing it. I've talked with a lot of kids that say that one of the things they don't like about drug education is they feel like they're saying that people are awful, evil people. And like one of them said to me, my dad has a problem with substance abuse, but he's not a bad man. And when you talk to me, I feel like he's a bad man. So then I really kind of changed my teaching to say like, hey, these people aren't bad because they're struggling with substance abuse issues. And so we might have a kid that is excelling really well at school, but that doesn't mean he's not having problems off the field or at home.
I'm remembering from like when I was in school, and a lot of the substance abuse education we got was, like peer pressure, like people are going to be pressuring you into it all the time. Do you think that's still a part of it?
Oh, peer pressure is definitely a part of it. I know, even kids, what you were talking about with the bathrooms, kids say they walk into the bathroom and there's a whole group of people doing it. And that's like one of the times when pressure is the worst. It's the same thing as it used to be still, like at a party. The crazy thing is that the peer pressure is finding them at places like school. It used to be you had to be, because people weren't typically smoking joints in the bathroom at school. And now they really can't get away from it. So that's really hard.
And I think that ties in a little bit to when you're talking about kids really want to be heard. I would imagine that translates and they want to be seen and understood and accepted.
Yes.
And if it appears to them that this is a group of people that would accept them, that could lead to doing things they maybe otherwise wouldn't.
Absolutely, yeah.
So as we head towards another school year, are there things that caregivers or community members should be mindful of when preparing kids to go back to school?
Well, I think the most important thing is to check in. Even older kids need to have that check-in, and they need somebody to say, like, how are you feeling about going back to school? And like, is there anything that you're concerned about? Is there anything that you're worried about? I think a lot of times we focus on younger kids and how what a difficult transition it is, but it's not going to be an easy transition for the older kids either. The other thing I would say is to be that safe space. And I know I've already said this, but be a safe space for kids where they know that you're someone that they can come talk to at the end of the day. And, maybe they're showing you emotions that aren't very positive, but they know that you're going to love them anyway. Just letting them know, like, hey, I'm going to be here for you no matter what. So being that safe space where they can come and they know that you'll always be there. And then I guess the last thing would probably be being involved, getting to know friends, getting to know their teachers. A lot of parents stop coming to things as their kids are in middle school and high school. And there's a lot of really neat parent programs out there. And it's so important, I think, to be known at the school and to know everybody that your student interacts with on a daily basis. This doesn't mean you have to be a detective, but building those relationships, that might make a teacher a lot more likely to say, reach out if they know you and say, hey, so-and-so's been having a hard time struggling in class. Whereas if you're a parent that they've never seen, they'd be a lot less likely to do so.
Yeah. And just thinking about how, my friends' parents were and my parents were, just knowing that there were other adults that were invested in who I was and what I was into and would maybe kind of call me out if I was like being a knucklehead kid. That wasn't my parent. Sometimes was more impactful. And then also nice to know just had other adults that I could go to if I needed to.
I do an activity with every class that I'm in where I have kids brainstorm at least 2 adults that are not their immediate parent or person who is raising them that they could go to if they needed to talk about something. And that might be, as you said, a friend's parent. That might be a coach, a pastor. It might be, maybe it's a cousin or an aunt or an uncle that's older, but just somebody that they can go to talk to, especially if it's about something that might have something to do with the parent.
And I think that goes back to the resilience you were talking about earlier when they've got these external resources. It's easier for them to kind of keep moving when things get tricky. That's such great advice, Gina. I'm so glad that we got to have this coffee break conversation today and kind of talk about how we can support teenagers through back to school, which can be kind of a awful time sometimes. So I'm glad we got to talk about this and that Wedgwood is really invested in teens in the community. So thank you for your work and thank you for being here today.
Thank you for having me.
Head over to wedgwood.org to learn more about our prevention and positive youth development programs or to get connected to additional mental health support and services. There'll be links in the episode description. Stay hopeful, stay helpful, and let's have another coffee break soon.